Hello, my name is Dr. Neil Baum from New Orleans, Louisiana, and I would like to take a few moments to describe for you the butterfly effect and its relationship to contemporary urology practice. The butterfly effect refers to small things producing a large impact. Imagine a single butterfly flapping its wings on one side of the planet and causing a tsunami or a typhoon several thousand miles away. I know that's a little bit hard to swallow, that may indeed occur, but let me give you an example that might be a little more applicable to what we are currently experiencing. Can you imagine a bat having animal-to-animal transmission to a pangolin in China, and that one animal in a marketplace in China has caused havoc throughout the entire world, which we now call the pandemic of COVID-19. So this points out that minute occurrences can have a significant impact over a large area and large numbers of people. So let me give you a few healthcare examples in the next 5 minutes. The telephone is your first impression of your practice in most instances. There's a world of difference between doctor's office, please hold, and good morning. This is Dr. Smith's office. This is Gwendolyn speaking. How may I help you? I can assure you that the patient who hears the latter response from the receptionist is going to feel more endeared to your practice than the former. I believe it's important to encourage the receptionist to smile. And in front of my phone and every phone in the office is a very inexpensive mirror, so the receptionist can see him or herself smile and get feedback, and that smile can be transmitted over the phone lines. You'll also notice that the handset has a reminder that telephone is equal to an opportunity. It's an opportunity to create a good first impression because you don't get a second chance to make a good first impression. Another example is to start the patient's experience before the patient is in the office. When they call the office for an appointment, have the receptionist direct the patient to the website where they can get demographic information. They can fill out demographic information, fill out the health questionnaire, and also find credible information regarding their urologic condition. This step alone will save patients 30 minutes when they have to come to the office to complete that information before they are seen by the urologist. One of the benefits of introducing the patient to the website before they come is this will often enhance patient satisfaction and the practice's online reputation. I think never before is it more important to demonstrate empathy and compassion to our patients. One of the easiest questions to ask in this day and age is to ask the patient, how has the pandemic affected their life? And then wait for their response. Make an effort not to interrupt the patient after starting the encounter. Historically, doctors have been recorded to listen for just 11 seconds before starting a conversation and then interrupting the patient. Continue to have a positive impact after the patient leaves the practice or discharged from the hospital. If the patient has an outpatient procedure, or if they had surgery in a one-day stay ambulatory surgical center or discharged from the hospital, it's such a nice gesture to have someone from your office call the patient, see how they're doing, see if they have any questions, make sure they understand how to take their medication, and make sure they have made a follow-up appointment. If the patient has a test or procedure, they are sent for an MRI or a CAT scan and the results are normal. Use telemedicine to give negative results to the patients. Patients don't need to be face-to-face with the physician to receive negative results. So what's the bottom line on this butterfly effect? It is true that in our medical practices, small incremental changes can make a large impact on our patients. Nearly every practice can benefit by making use of the butterfly effect because it will absolutely improve your relationships with your patients and will absolutely have an opportunity for a positive impact on your patients. If you have any questions about the butterfly effect, or you have any examples that you have used in your practice that you would like to share with our colleagues on Grand Rounds in Urology, please let me hear from you. Thank you.